Okay, we're going to talk today a little bit about what you can do with your pets at home, particularly if they're getting older and maybe some senior patients like Nan here, just to be able to do a good, thorough evaluation and see if there's anything that seems abnormal or wrong or something that needs to be checked out. I think the key thing here is always going to be just not necessarily knowing exactly what's wrong, but knowing that something isn't completely 100% normal, which would prompt you to either make a phone call or bring your pet in to see the veterinarian so that they can then tell you exactly what's wrong. So the key thing is just knowing from your end what looks normal and what doesn't look normal. So we're going to use Nan here. We're going to start right from her nose and we'll work our way down to her tail and see how things look. But the first thing, just we can just look at their eyes, and Nan's eyes look nice and clear, and I don't see anything, no evidence of any cataracts or anything like that. The eyes aren't red, and there's nothing that looks abnormal or unusual about her eyes at all. And so this is something you can do real easily at home. Just take a nice, good, close look. Even if you need to get a flashlight and get some extra light on there, if it's going to be a little easier for you, you can just make sure that you don't see anything that's too unusual. Even looking at her nose here, there's nothing. She doesn't have any discharge from her nose or anything like that. Very commonly with some dogs, especially older dogs, you'll see some little growths like this. You can see on the side of her nose right here, she's got this little teeny tiny little raised spot right here. And these are little benign, what are called papillomas in dogs. They're just little teeny tiny growths that a lot of older dogs will get. And they're generally nothing to worry about. If they're growing real rapidly, if they are oozing and bleeding and things, those would be all things that that you should take in and have the veterinarian look at and make sure there's nothing else that seems worrisome. But these are pretty common things for us to see. Nan has nice little floppy ears here, so it's not super easy to just see right in there, but we can flip up her ear and we can look right down in here. And again, we don't see any discharge in there or any redness or any signs that she's been scratching at that. And we just want to make sure we flip up those ears and look at both of them, make sure they look good. And her ears look real good. Next thing around their head and face here is obviously looking at their mouth and their teeth. And so, if you don't pick up this lip, you're not going to be able to see the teeth. But as we pick up this lip, we can see she has just a little bit of tartar on her teeth, but nothing needs to be any cleaning or anything. If you open this up and you see a whole bunch of tartar on her teeth and some bad odor and the gums are real red, those are things a lot of dogs need to have some dental work done that you'd need to have them looked at so they can know whether or not their teeth are okay. Let's get you to stand up, Nan. There you go. The other good thing about Nan is she's got nice short hair. So if she had any lumps or bumps or anything that looked unusual on her skin, it'd be pretty easy to see. But a lot of dogs have long hair. It makes it a lot more difficult to see those things. So just doing your normal petting, just rubbing around her neck and down her body and her back and her underside and even down these legs, just to see if we feel anything that seems a lump or bump or feels unusual. And the other thing too is, are they painful somewhere? Maybe you start touching around her shoulder or her hips and she gets real reactive and doesn't like that. Maybe that's a sign that she's uncomfortable and maybe has some arthritis or things along those lines. So you can do those things very easily. So we're just kind of getting our hands on her legs and feeling around everything. Picking up their feet and looking at underneath their paws, make sure their nails are okay. These are other things that you can do very, very easily at home. Again, you don't need to know for sure what's wrong. You just need to know, hey, this doesn't look right, and let me take them in and have the veterinarian look at them. Not the best, most awesome thing to do, but pick up that tail and make sure we don't see anything around their hind end. A lot of times that tail's down. Longer haired dogs you won't necessarily see around their hind end too easily. So just take a good look there and make sure we don't see anything again that looks unusual or strange, lumps or bumps or anything that we find is unusual. So those are the real basic things you can do at home to make sure that you don't see anything that's abnormal or unusual. And again, I can't stress it enough. You don't need to know exactly what's going on. You just need to know, hey, this doesn't look normal, and let me get my pet into the veterinarian and have them tell me what's going on. We'll obviously do some more thorough things, palpating their abdomen, listening with our stethoscope with their heart and lungs, things that would be difficult to do at home. But that's kind of why we try and do that, at least regular exams and screenings in the office as well. So Nan was a good patient and is looking good and healthy today.